Hi guys, just coming on here really quick to do a quick video on hospitals mandating the COVID vaccine for their employees. I've got just a little time to record because if you know me, you know I've got two kids and they are both miraculously down for naps right now. So I'm gonna try and get this recorded in a short amount of time, hence why I'm like not ready, because I don't have time to get ready. I got time to record a 10-minute video. I don't have time to get ready for 10 minutes and record a video. Anyways, beyond the point, I wanted to make this video to kind of share my 2 cents on this topic, because I know that a lot of hospitals just came out that they are mandating the COVID vaccine for their employees, mine being one of them. And there is like a whole bunch of just uproar from one, the public, two, from the bedside staff, the ancillary staff, and everyone. And so I want to share my thoughts on it. For one, so if you don't know me and you're watching this, but I'm an ICU nurse in Arizona, and I have been working in a COVID unit since COVID first hit Arizona and we started to receive COVID ICU patients. I have seen a lot of different scary things, and so it's easy for me to be a little bit biased in this sense, because I have seen a lot of people die that shouldn't have died. I've seen what it's like to be working during a pandemic. I have worked a pandemic. It's just been a lot for a lot of nurses the last like year and a half since COVID hit. So I am vaccinated. I did get the COVID vaccine. I was pregnant during the COVID pandemic. Right when the vaccine came out was towards the end of my pregnancy. I did not get it while I was pregnant, but after I gave birth, I decided to get the vaccine. I got the Johnson & Johnson vaccine. A lot of people ask, but really like any of the vaccines are great. So my thoughts, here's my thoughts on this, is that all vaccines are mandated for bedside nurses and whatnot at the hospital I work in. And when you first become an employee there, you are required to submit your vaccine records. And if you do not have a vaccine, one of the vaccines, you're required to get it. And depending on the vaccine, if you decide you do not want to get it, then you have to have a medical waiver note from your doctor saying that you are exempt from getting this vaccine. And that's the same thing with the yearly flu shot. You are mandated as an employee at my hospital, just like most hospitals, to get the flu vaccine. And if you decide to not get it, then you have to get a waiver from your physician that says that you are not getting the flu vaccine and you've been educated on why you're not getting it, or why you're choosing to not get it. So that's where we're at as far as this COVID vaccine. I think that this is something that was going to happen in a matter of time regardless, especially with how many people have died from this pandemic, how crazy it's spread through our population, that this vaccine was going to be mandated for employees at one point or another. With the rise of the Delta variant, and we're seeing just an influx of COVID patients, it's kind of an optimal time to try and get this disease back under control. I can say, as a nurse that's been working this pandemic, nurses are burnt out. We are very scared about having another huge wave of COVID patients. And unfortunately, the majority of patients in the ICU that I'm working in, and from what I've talked to other nurses about in other ICUs, are unvaccinated COVID patients. And I'm not saying that in a way to shame the patients that did not receive the vaccine. But it's scary. It's scary that these patients are coming in unvaccinated, and they're literally telling me and my coworkers and nurses, like asking, can I get that vaccine now? Like, is it going to help me if I got it right now? And unfortunately, they're in a spot where it's not. They are literally, these patients are looking death in the face, regretting not getting a vaccine and just having like the chills or fevers or muscle aches for 24 hours. And it's really sad and scary to be in that position. So how I feel about this being mandated is that it's a step that was going to happen in a matter of time regardless. And that if people truly do not want to get the vaccine, then they can always go to their physician and ask for an exemption. I was told by an ER doctor, this was years ago, back before COVID, and he had people asking for him to sign a waiver to exempt them from the vaccine. And he said, it's not my job to tell them they must get the vaccine or they must not. It's just my job to educate them on the importance of getting the vaccine, and they ultimately can make that educated decision to not get it. And ultimately, you still have that right to make an educated decision to not get the vaccine. It's just now being required or mandated for employees to try and encourage more people to get it. It's a hard position for me to be in because I respect when people don't want to get the vaccine in the sense of they have a really good reason to not get it. I know there are people out there that cannot get the vaccine because of X, Y, and Z, and that's great. But being at the bedside, literally looking COVID in the face, being sprayed with COVID in the face, like, I don't understand why nurses would not be more inclined to try and get the vaccine unless they have a really, really good reason not to. It's scary, guys. It's scary. And if you're a non-medical person, or you are a non-medical person that's like, or maybe you're a medical person that hasn't worked with COVID patients, it's hard. I, the other day, had 2 patients on 100% oxygen, both on BiPAPs, breathing 40 to 50 times a minute, and their oxygen levels never went above 85. That was good. 85% was good. It was just a matter of time. They were just riding that line before getting intubated. But the hard thing is mentally, both of them were there, and both of them told me, when can I get that COVID vaccine? I regret not getting it. And it's just a scary position to be in. And I've shared this with a lot of people, and a lot of people agree with me. And then I'm also getting messages that say, well, you shouldn't be pushing the vaccine. You should be pushing exercising and eating healthy and all those things. And yes, those are all very, 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 very important things. Exercising, taking care of yourself, yes. But what about the people that can't get the vaccine because of X, Y, and Z, and they're not protected? What about your 80-year-old grandma or grandpa who is elderly and they're more at risk for having complications from COVID and getting severely sick from it? Exercise isn't always going to save everyone. Eating healthy is not always going to save everyone, and I get it plays a very important role in this. It's just one piece of the puzzle, and the vaccine is another piece. And so that's where I'm at. I like that the hospital's mandating it. If people are against it, they can be exempt and go get your medical waiver against it. But I think that we need to really encourage people to get the vaccine because it's scary. I hate for people to regret not getting it when they are on their deathbed, essentially. And especially when your mind is sound and you're realizing, dang, if I would have gotten that shot, I wouldn't be having to make this decision, or most likely would not be in that position. I think that's worth the low risk of having a vaccine reaction. So that's my 2 cents. I know this is going to get a lot of opinions one way or another. Just know that, like, let's have respectful discussions here. If you're watching the video to this point, like, let's be respectful. Everyone has their own opinion on this. This is my opinion. Being a medical professional who has worked with a lot of COVID patients and seen a lot of really, 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 really terrible things. I need to make a video on just all the terrible things I've seen during COVID. It's just, I never want this to happen again. I never want this pandemic to happen again in my nursing career or anyone's nursing career. But it's scary. So thank you guys for watching this video. If you want to share your opinion down below, go for it. Let's play nice, everyone. Play nice in the comments, and I will see you in my next video. Bye.